Welcome back, everybody. We are talking with Kim Stager and Kerry Evers from Nutritional Healing. Both these ladies are doing some incredible things in changing lives. And today, of course, we see so many people struggling to figure out what's going on with their bodies, and doctors struggling to give them answers. So these ladies can maybe help you out. Good morning.
Good morning.
Thanks for being here.
Thank you.
So Kim, let's talk about nutritional healing. There, how are you guys helping, changing, just making a difference for people who've tried everything and they just feel hopeless? And I think this is the time of year where we're trying on or looking at the swimsuits and looking at the shorts, and it can be very intimidating.
Right. You're definitely realizing, oh my gosh, it's time to really take my health back.
Yeah, exactly.
Ultimately, what nutritional healing does is restore hope and give people personalized nutrition programs. We do blood work. We do food sensitivity testing. You meet one-on-one with a nutritionist. We monitor your weight throughout the whole program to make sure it's a sustainable health progress that we're doing for you. You know, it's no surprise most people are waking up every day not feeling so good. And we commonly hear, I just can't lose the weight. I've got digestive issues. So we're going to the doctor or seeing a specialist. And it's like, why do I feel so bloated? Why am I in pain? And we hear a lot about constipation and diarrhea. And it can be very embarrassing to talk about, but they're very serious conditions that people are dealing with. 9 times out of 10, then the solution is, okay, well, let's take a prescription medication. We often hear in our office that, let's say, acid reflux disease. Okay, so we'll take a prescription for that. Then after a couple of years of taking this, we're developing new symptoms. And now we don't have enough acid in our system to digest food in general. So we get a diagnosis of IBS. So these are things we're helping people kind of reel it in. Let's get back to basics. And the best medicine is to learn how not to need it. And that's our goal.
Really good point. We actually have some before and afters of some of the patients who have come to you with,
amazing
with issues.
progress.
Yeah. So who are we seeing right here?
This is one of our amazing clients, Jill, and just going through some of those similar stories of just taking your health back and getting to the root cause of why this started in the first place.
She looks so happy.
Yeah.
Oh, I know.
She's
Fantastic.
so great.
I mean, and that's what you guys are all about, is getting those smiles back on people's, faces and getting us in control of our lives. So, Kerry, let's talk a little bit about why do you think so many people are struggling with digestive health and their weight in the first place?
You know, honestly, what we see is that a lot of times it starts with the diagnosis. So, most of the time what people are dealing with today isn't technically a disease. There's not a pathology there. It's a collection of symptoms. So giving it a name, you have XYZ disease. Today, you could have 10 other symptoms that somebody with the same disease doesn't have. And that's where the struggle is, because once you get a name, that doesn't really mean you got an answer. So what we work with people is figuring out, okay, if you have chronic symptoms, what insults and stressors really brought that on? Where did this come from? And it can be mechanical, whether you had an injury or a surgery or poor posture, something like that, or it can be chemical from a poor diet or drug interactions and medications. It can be emotional. How stressed out are we these days? Just poor sleep, things like that. So what we think of it as being, going to your doctor's office is like going to the mechanic and getting the diagnosis that you have a flat tire. That's great, but the prescription for that is more air in the tire. However, if you don't do anything to change your diet, change your lifestyle, learn how to remove the stressor, remove the hole in your tire, all that air isn't going to do anything. So we work with the medical community to help people remove the stressors that brought this on in the first place, remove the insults that are making this an ongoing issue, so that the diagnosis isn't really necessary at that point. And it's been pretty awesome to see people make those changes.
It is super cool because it's a process. I mean, you really sit down and get to know your clients and your patients, and you go through a lot of testing, because everybody's body is different. So there's not one quick fix for everybody.
That's true.
It's a whole plan and a program that you guys put together, and you'll do it for the people who are watching, and you have kind of a cool thing that you're going to offer our viewers.
Yes, so if this, any of this resonates with you, because it is happening, it's very serious, for the first 20 callers that mention this segment to our office, and 920 Healing is our number, we'll offer $100 off any of our programs.
And so, people want to find out more and get into this a little bit deeper and find out exactly what you guys do. They can do that by making an appointment.
Everybody who starts with us comes in, they sit down with a health history, and they will sit down with Kim or I for a full hour to go through that and make sure that we know what brought them here and what their goals are, and we will help them decide what the best program is. It's a free consultation. It's very low pressure. We're very relaxed.
It's us.
Yeah.
It's us. So you already know
They're
us.
really nice people. So and their mission is to help you out and get you on track and healthy again. Ladies, thank you so much again.
Thank
the number
you.
to call for people who want to call and take advantage of the offer.
920 Healing.
All right. Thanks, ladies. Appreciate it.
Thanks,
Thanks, Amy.